Earlier today, I met with Dr. Kenton Kramer.
Governor David Ige live-streamed this press conference from Oahu on Wednesday. The topic was rat lungworm disease,
a serious and debilitating disease.
the frightening sickness that has been plaguing Hawaii Island for years.
Between January and May of this year, 2017, we've had 15 confirmed cases of rat lungworm disease in Hawaii. 9 of these cases were on Hawaii Island, and 6 were on Maui.
And in recent months has become a statewide concern.
Some of these patients have devastating outcomes.
The governor was joined by state health officials.
And we want to acknowledge the angst felt by our Puna and our Hana communities particularly.
And agriculture heads.
Department of Agriculture continues to work in tandem,
explaining what they plan to do with the funds allocated by the state legislature in this year's budget.
The Department of Health is working together with the Governor's Joint Task Force and will spearhead a targeted approach to responding to and preventing rat lungworm disease in Hawaii. We now have a PSA that we wanted to share with you that you will be seeing soon on television.
The good news is you can prevent it by simply washing your produce thoroughly and making sure you don't consume slugs and snails.
We'll air a series of public service announcements on television and radio stations statewide throughout the year. In addition, our epidemiology and vector control programs, in partnership with the U.S. Centers for Disease Control and Prevention, will conduct a targeted, concurrent rat, slug, and snail sample survey that's guided by our current disease data. The survey findings will provide a foundation to guide more effective public health measures in the second year of the legislature's funding. A statewide survey of this kind has never been conducted in Hawaii before.
Questions from the media focused on the involvement of the Daniel K. Inouye College of Pharmacy at the University of Hawaii at Hilo,
because we realized how serious this and debilitating this disease could be.
Where Dr. Susan Jarvie has been leading the research on the disease.
Well, they are very much included. Dr. Jarvie is on the Governor's Rat Lungworm Task Force, and I have worked together with her Dean of the School of Pharmacy in Hilo, as well as with the Chancellor there, and we are all working together on this now.
For research, we need better diagnostics and better treatment. We're working on the diagnostics portion right now.
Jarvie says they need funding to finish the important studies.
There need to be water treatment studies. What is the best way to treat your catchment water? Vegetable rinse studies.
She hoped to find it at the legislature this year.
The last 2 years, I tried to get some funding for our rat lungworm lab at the UH Hilo School of Pharmacy.
But the state's money went to the Department of Health instead.
It was because we were fighting among ourselves for pure political reasons.
Puna State Senator Russell Ruderman said recently there is more to the story than meets the eye.
This senator was in a tiff with the money chair. And that money chair punished that senator by killing everything she could of that senator's. I think playing that kind of game with this kind of issue is outrageous. If we were all adults in the room, we would say, Department of Health, you got all this money you don't even know what to do with. Let's share it with the rat lungworm lab and all work together to solve this problem, because we need vector control and we need research.
The Georgia lab in Hilo has been working on a quick diagnostic test but did not receive any funding. Could you indicate why the department decided not to share any of the funding with the lab doing a lot of research?
Yeah, I'll turn that over to somebody else.
Yeah, well, I'm going to ask Dr. Kramer to come back on that, because the serological test, we're aware of specimens being sent to the Centers for Disease Control and are working together with those experts there. There is yet to be a validated serological test, and there's research going on throughout the university by multiple faculty, and I'm going to let Dr. Kramer address some of that. There's quite a few researchers at the university working on this.
Over 90% of those rats were positive for rat lungworm.
Jarvie has not given up.
We have an epidemic proportion of our rats being positive for rat lungworm.
She keeps making appearances when called upon, including this county council meeting in Hilo.
And education is no doubt very, very important, but this problem is bigger than that.
Held the day before the governor's press conference.
Safe eating is healthy eating, and wash your veggies. Very, very good advice. But washing your veggies with water does not make them safe. It makes them safer. Okay? So these larvae, these rat lungworm organisms live in water. We've had them in our lab, the infectious stage, out to 3 weeks, growing just in water. We now have a culture that when you give them a little food, we're out to 4 months. We can keep these guys alive. And so just washing your vegetables in water, especially in an area where you have such high, widespread, unregulated catchment use, where a lot of people do not have fresh, potable water to wash their vegetables in. So that's a very big problem.
What we're here today to talk about is a big objective of getting this out.
Health officials presented their plans for an increased educational campaign.
So in an effort to prevent foodborne illnesses, including rat lungworm disease, extension agents like myself around the state have been conducting training for farmers and producers on good agricultural practices, produce safety, and the requirements of the Federal Food Safety Modernization Act. We also educate home gardeners and consumers on safe food handling practices, including proper cleaning and preparation of fruits and vegetables.
To me, that's not sufficient.
But Puna Councilwoman Eileen O'Hara sees the need for expanded research.
Where we're passing out information that is not well researched, documented, firmly identifies ways to avoid transmission of this disease, we're not doing enough.
In particular, as it relates to catchment water systems.
It suggests that people use as small as a 5-micron filter. Most of the filters that are commonly used are 10 or 20 microns. So it was suggested that use of a 5-micron may protect you from rat lungworm disease. But to me, that's not sufficient.
We need research on catchment systems, best design for catchment systems to try to block the larvae from entering into household water supplies as well as agricultural water supplies. We know people can get infected by ingesting contaminated water. We've lost a baby, at least one child, that there's no way this baby could have gotten rat lungworm other than in the bathtub. So the water issue is a really big issue, and we need to have research on that.
And for us, that primary transmission route still appears to be that accidental or intended ingestion of either a raw or undercooked snow or slug. So if certainly when the investigations start pointing to that, I do think that it's gonna certainly look into that a little bit more, but it's really hard to pinpoint that exact exposure. So from a theoretical perspective, yes, it is possible. And, the Department of Health is not really set up to be a research organization per se. And so, we do look for, the best researchers from around the world to really drive that kind of our guidelines and our thoughts.
Okay, so if I heard you correctly, are you saying that rat lungworm, that it's questionable if it does transfer through water?
To my knowledge, I don't believe there's been one confirmed case from the Department of Health that has been directly attributed to exposure. Some of the people that I think have reported have claimed that, yes, it was my catchment, but like I said, it's extremely hard to know that exactly where the exposure occurred. We do know that, as mentioned, that it can live in water for some time. And with a proper filtration system, in theory, like I said, we do need to study this a little bit more. But it should be working through it. UV system the UV light hasn't been tested at that particular power to kill the nematode, because as I've talked to some of the outfitters here, anything larger than 5 microns is not going to really be affected by a UV system. And though some literature has looked at X-ray and gamma radiation in order to inactivate them and is successful in doing so, that's kind of out of the scope of a home consumer to have that system. And so, catchment very well could be a transmission route, and considering how many people are on catchment here, if it was there might be other factors that are associated with that in terms of how much maintenance they have, what they use it for, how they use it. That may have more factors into it, because we have a lot of people on that are using catchment. We have a lot of people that are maintaining it well, and so I assume some people that aren't.
I'm just concerned that if that's all we're doing is passing out educational materials where we still don't know the answers, it's just not enough. We need to be putting money into research. So I would like to know, of the $500,000 that the Department of Health was given for each of the next 2 years, how do we, the county council on the Big Island, where we are seeing the greatest negative health impacts from this disease, and data being what it is, I don't think that we have collected data on all of the affected cases. A lot of people never got tested. A lot of people are out there who have rat lungworm disease who were never positively tested for it because we don't have a really good test yet. So there's so much research that needs to be done. I would like to know what we, the county council, can do to encourage expenditure of some of that funds for research. It's not enough just to spend it on public education. Can we pass a resolution to encourage, or do you want to hear individually from us as council members? How is it best to push that point? Because I'm very concerned about the lack of research dollars being directed at this problem.